More than 1 billion people worldwide suffer from vision impairment. And one such eye disease is glaucoma, which comes later on in life. It's one of the leading causes of blindness globally. While the damage caused by glaucoma cannot be reversed, there are treatments that can help slow or prevent vision loss, especially if detected in its early stages. We're Together in Health. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Glaucoma can affect people of all ages, but is most common in adults in their 40s or older. Let's welcome our guest for today. We're joined by Dr. Leo Cubillan. He's an ophthalmologist and director of the Philippine Eye Research Institute. Also with us is Dr. Edgar Leuenberger. He's the co-director of the Asian Eye Institute's Glaucoma Service. Thank you, doctors, for joining us on the program today. Now, glaucoma is a condition that damages the eye's optic nerve, which may worsen over time. Now, the optic nerve is not just one solid fiber. It's like little fibers all compressed together. Dr. Edgar, could you explain to our viewers how the optic nerve mainly functions and how it is damaged by glaucoma?
The optic nerve is very similar to the cable of your telephone. And that is the connection between your eye and the brain. And as you said, there are many fibers that run through it. And if the pressure is high, the main target of damage is the optic nerve. So even if your eyeball is okay, if you damage the conduit between the eyeball and the brain, then you can lose vision gradually and permanently.
Now, with this increased buildup of pressure, it can, as we said, damage the optic nerve, which is connected to our brain, which is responsible for our vision. Now, does this happen to just one eye, Dr. Edgar, or are both eyes affected at the same time? Can it happen to just one or both?
Now, there are two main types of glaucoma. As you said, there's the open angle and the closed angle. And in general, the closed and the open angle have primary and secondary. Primary means you are born with it. Secondary, there's something that happened to your eye after birth. So if it's primary, most of the time, it's genetic and it happens on both eyes. And the eyes are considered twins, so one eye is ahead of the other. While if it is a secondary cause, such as caused by a surgery or trauma or steroid or any kind of accident to the eye, then it's usually unilateral or only on one eye.
Gaano ka prevalent or gaano ka common ba ang glaucoma dito sa atin?
Based on the 2018 Philippine eye disease study na ginawa natin all over the country, among those that are visually impaired, pag sinabi nating visually impaired, if you show the Snellen chart, if the patient can only read the first two lines of the chart, they are considered visually impaired. Glaucoma ranks number 3 as the cause of visual impairment. So there are around 300,000 Filipinos who are visually impaired and have glaucoma.
It's really common when it comes to vision loss. I know that this could be a factor for that. I think it's also important to mention some of the risk factors involved with this. Could you name some of them, Dr. Leo?
So among the risk factors for glaucoma would be family history of glaucoma. When patient is above 40 years old, when they have hypertension, and some patients may develop glaucoma if they are taking steroids or they're using steroid eye drops, or in cases where they have previous eye surgeries. Those are the risk factors for glaucoma.
Dr. Edgar, this one's for you. So a lot of risk factors were mentioned by Dr. Leo, but the tricky thing about glaucoma is the main reason being an increase in the pressure in the eye. But some people with increased pressure in the eye may not even develop glaucoma, while some people with normal pressure in the eye may also develop glaucoma. So this can be a little bit confusing. Could you shed some light into this, Dr. Edgar?
First, for Dr. Gomez, for the group of people with high pressure that don't develop glaucoma, it's actually just a minority, and their pressure ranges usually stay within 20 to 30. The normal pressure is 10 to 20. And when the doctor detects your pressure to be about 20, as long as it does not go beyond 30, there is a subset of patients who throughout life don't develop glaucoma. It just goes to show na matibay yung optic nerve nila and they can withstand the pressure. On the same token, there are patients who have been known to have normal pressure, but because hindi matibay yung ugat nila, they crumble. The optic nerve crumbles under normal pressure. And this is what we call normal tension glaucoma. So for the high pressure type within 20 to 30 who don't develop glaucoma, we call them ocular hypertensive patients. They don't have optic nerve damage, but their pressure needs to be watched.
Let's talk about first the more common type, which is the open angle type of glaucoma. In really simplified terms, what should our viewers know about open angle closure glaucoma?
The main difference between open and angle closure is that in open angle, if you look at the drainage system of your sink, sa lababo natin in the kitchen, you can see down the drain. That means that if you shine your cell phone light down into the drain, you will see that the drain is open. Walang nakabara, no? But somewhere down the drain, when the pipe goes into the main collecting pipes, there is a block that you cannot see. In open angle glaucoma, when we examine the patient under the microscope, we look at the drain and we cannot see anything blocking, but the pressure is up. So somewhere down the drain, there's something blocking. In angle closure glaucoma, when we look at the drain, kitang-kita namin yung bara, no? So if you look at the drainage of your kitchen sink and you shine a light into the drain pipe, you will see that there might be some debris or a cloth blocking it. So just the same as the eye, when we look at it under the microscope, we can see either the iris or any kind of debris inside the eye, like blood cells or fibrin covering the angles, and we call it a closed angle glaucoma.
Okay.
So the main difference is just how we look inside the eye and if we see if the drain is open or not.
Okay, but Dr. Edgar, of the two types, no open and closed, there's one actually that is a medical emergency. Dapat talaga bigyan ng pansin. Which one is it among the two?
Yes, it's the angle closure that will cause headaches, vomiting, nausea, very similar to a stroke. No? Kasi biglaan yun. When the angle is closed by something blocks it and the eye pressure goes up abruptly. And it is an emergency. The patient really cannot tolerate the pain, starts vomiting, and it usually happens in the middle of the night that they are brought to the emergency room. And medications, lasers, or surgery needs to be given, instituted right away.
Okay.
Unlike open angle glaucoma, which is very sneaky, no? It's like a thief in the night.
Okay, that's very good na alam ng viewers natin yung difference ng dalawa. And having regular eye exams can prevent vision loss due to either closed or open angle glaucoma. We'll talk about this and more when we come back on MedTalk Health Talk on CNN Philippines. For your connection to healthcare. If glaucoma is detected early, vision loss can be slowed down or even prevented. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines, where your healthcare comes first. Since glaucoma can destroy vision before any signs and symptoms appear, you can have it and not even know about it. So getting a comprehensive eye exam is the only way to catch glaucoma early. Dr. Leo, what can someone expect during a comprehensive eye exam?
During a comprehensive eye exam, when you go to your ophthalmologist, they will check your vision. They will check also your eye pressure. They will check the movement of your eye. They will check the status of your cornea. And also, they can check the status of your retina. And sometimes, if needed, if glaucoma is suspected, they will check the status of your visual field. So these are the things that are done in a comprehensive eye exam.
Okay, so just to note for our viewers as well, comprehensive eye exam is much different than the eye exam that you might get in the mall whenever you try and fit some new glasses. Dr. Leo, at what age should someone consider getting their comprehensive eye exams regularly?
It is recommended that they do a comprehensive eye exam every 1 to 2 years when they are 40 years old and above.
Okay, very good. Now, what we want to prevent here, of course, is that the increased eye pressure will cause some disruption in your vision. So treatment for this can help slow down or even prevent vision loss, especially if it is detected right away. And as we said, glaucoma is caused by an abnormally high pressure in the eye. So when it comes to treatment, your doctor will try and lower your eye pressure, and that starts primarily by using eye drops. Dr. Edgar, let's explain the importance of these eye drops and what are they intended to do, and if they don't work, what's the next step?
There are three different stages of glaucoma when we treat them. First, it starts with mild, where patients have been detected early on in the disease, and usually we give eye drops. And sometimes, if the angles are open, we can give laser. Or if it's an emergency, then of course we give eye drops and lasers and sometimes surgery. But if it's not an emergency and they are in the moderate stage, then we can consider giving eye drops plus laser. But if they proceed to becoming worse in the severe conditions, then there's no choice but to save the eye and do surgery in this patient.
If someone has already some signs of vision loss, Dr. Edgar, can that vision go back to normal, or is there some permanent damage already once that happens?
Glaucoma has always been thought to be a permanently blinding disease. It's like the candle that slowly gets smaller and smaller as the fire burns. So the earlier you catch it, the longer the candle can be left there. So the trick really is to detect it early. And how to detect it early? To know your family history. If you're putting steroids, don't wait for 40 years old. Have your eyes checked right away. And so if you are looking for ways of preserving your vision, detecting early is the key. Now, if you lose some vision along the way and you detect it late, unfortunately, whatever the doctor catches is what we can preserve. It's like the firemen and the fire truck catching a burning house. So the earlier you put out the fire, the better for the patient.
Dr. Leo, could you give us a more detailed explanation on what someone with vision loss from glaucoma is actually experiencing? Biglaan lang bang nawawalan ng vision ito, or is this more of a gradual process?
It's a gradual process. So, in fact, half of the patients with glaucoma, they don't even know they have glaucoma. And that's why it's really important that, when they have the comprehensive exam, that's when it could be detected if they have glaucoma. Since majority of glaucoma among Asians, 3 out of 4 would be open-angle glaucoma. This is the type of glaucoma that it's slowly progressing. Patients may not have any symptoms. And towards the end, because the damage would start from periphery, so in the end, they would have tunnel vision. So they may have normal vision. They could see the small letters, but it's tunnel vision. So they can only see that portion, but the rest of the visual field is blurred. That's one of the tests for glaucoma. They do visual field, and that's where the damage to the nerve is seen, as that they cannot see the peripheral vision.
Okay, so if you have any of these symptoms, that gradual tunnel vision that you may experience, loss of vision in your periphery, please go check with your ophthalmologist as soon as possible. Now, Dr. Edgar, you mentioned earlier that there is treatment for this in the form of laser therapy. Now, is everyone with glaucoma a good candidate for laser therapy?
Actually, the ones in the mild stages are very good candidates for lasers for both open and angle closure types. So that's the reason why we really are very aggressive in the early stages of glaucoma, because laser really keeps their quality of life intact. Once you get into the moderate to severe and you start doing surgery, the treatment alone can alter their quality of life. And therefore, as much as possible, have your eyes checked as early as possible. So if ever there's a need to treat it, the worst thing that can happen would be laser.
And self-care steps are key in detecting glaucoma in its early stages, which can help prevent vision loss or even slow down its progress. We'll have more of this after the break. Stay with us. You're watching MedTalk Health Talk on CNN Philippines, your connection to healthcare. Glaucoma may be a lifelong condition that needs continuous care and follow-ups with your eye doctor. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're committed to making communities healthier, especially in this time of COVID-19. Now, as we've been stressing throughout the episode, it is best to prevent glaucoma and its maybe accompanying vision loss caused by this if possible. So the first step is to get regular eye examinations. Dr. Leo, could you explain again to our viewers why this is very important?
Regular eye examination is important because, as I mentioned earlier, that the half of the patients with glaucoma, they may not know they have glaucoma. So the only way to determine is when you have an eye exam where the doctor, it's a comprehensive eye exam where the doctor would check your vision, your status of your cornea, and your lens, retina, as well as the eye pressure and other tests that may be needed.
During this pandemic, a lot of people are still wary for face-to-face conversations with their ophthalmologist. Is this comprehensive eye exam something that is needed to be done really face-to-face with your doctor?
This has to be done face-to-face. So it's important that we follow the health protocols of the hospital when we see the doctor. And of course, it would be important if people would be vaccinated so that when they are fully vaccinated, there will be less risk going to the hospital for an examination.
Yes, that is very true. So to our viewers, if you need a comprehensive eye exam, don't be afraid to follow your ophthalmologist's advice, and all these protocols will be there for your safety as well. Now, Dr. Edgar, can you give some tips on how to live better, how to have a better quality of life with glaucoma?
Dr. Freddy, that's a question that is always asked of me. After we've done everything, the patients would ask, is there anything that I can do to make my glaucoma better or to give my vision a chance to last longer? Of course, there are many things that you can do. Number one is avoid stress. Stress is the number one cause of disorders in the body. It can cause strokes, heart attacks, and even worsening of your eye condition as it releases a lot of cortisol. And so a lot of meditation, listening to relaxing music, and avoiding too much interaction with your gadgets, tablets, cell phones, and staying up late. And all these things contribute to really disruption in the well-being of your body. Now, exercise is an important thing, but the warning about exercise is that we should not overdo it. And, mild to moderate exercise. Problem with glaucoma patients is that if you ask them to exercise, first they have poor vision and there's a risk for accidents. And so we don't want them to go jogging outdoors, maybe safely do swimming, stationary bike, go on the treadmill, but everything has to be done safely. And of course, when you lie down, make sure you don't face down and you put a little more pillows under your head, because those activities have been shown in studies that they lower the eye pressure, not necessarily controlling the glaucoma, but you can modify one of the risk factors to get that glaucoma under control.
Okay. Now, Dr. Edgar, ang paboritong tanong is, meron bang bawal kainin kapag may glaucoma?
Of course, diet as tolerated and as advised by your doctor, depending on your comorbidities. But there are many things, many food stuff that you can eat, like green leafy vegetables, can contribute to your eye health. And studies have shown that the greener the vegetable, the better for your eye.
Very good advice. And with that, I'd like to thank ophthalmologist Dr. Leo Cubillan and Dr. Edgar Leuenberger for joining us on the show. It was very, very nice having you both. Getting diagnosed with glaucoma can be daunting, especially for older people who are dealing with several other problems that come with age. But vision loss can be prevented if the disease is recognized in its early stages. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, your partner for a lifetime of good health.